want to start by just giving you guys a little bit more background. Now that you've seen that video and have a little bit of a primer on what this issue looks like, I want to give you a little bit more context for the event today and why my mom and I feel so passionately about this. So, I'm Emily, as a lot of you know. I am a survivor of severe postpartum anxiety, depression, and OCD. And I also happen to work in healthcare administration. So, as you can imagine, I came out of this experience with just a million questions and concerns around how many gaps exist in healthcare today for women who are struggling. So, I think, like Stephen was saying in that video, we've come a long way, but honestly, my experience was in 2023, and we still have so far to go. So I came back from maternity leave super fired up, so unbelievably grateful, because I ended up getting eventually access to some incredible resources that have allowed me to really get back on my feet and enjoy my son so much in my role as a mom. So I started speaking up about that and tried to advocate for changes within healthcare first. And I just quickly learned how much harder that was going to be than I thought, just to make change within any large institution. So, but as I hope you took away from that video, this isn't something that can wait. There's a lot of people every single day who are struggling. So I was talking about it with my mom, and fortunately I grew up with an amazing example from my mom of how you can just do things and harness the power of your local community. So I've been to an event here, I learned that you can just rent library space for free. So I was like, well, let's give it a try, because if nothing else, we can share a little bit about what we've learned with other people. And then you can have this information if you ever hear that somebody seems to be struggling. Hopefully it'll equip you with a little bit more information than we had going into all of it. So, a little bit about me. I am, of course, the mom of an incredible, almost 2-year-old Julian, who a lot of you guys know. I am also married to an internal medicine resident at the University of Minnesota. So another reason why this has been such a passion for us is if we, as a physician healthcare administrator duo, couldn't figure out how to get help, then it's not going to happen for a lot of people. And so that's made us really want to talk about it. I have a Master of Healthcare Administration from University of Minnesota School of Public Health, and before that I have a bachelor's in economics. And currently I'm a strategic advisor at a local health system, and I also coach gymnastics part-time. But most importantly, for why we're here today, I have lived experience with severe perinatal anxiety and depression. So I'm not going to spend too long today on my own story, because we just watched a lot of stories, and I know some of you guys have experience with this yourself or have seen it in a loved one. So I just want to talk about a few of the highlights from my journey, because I think what's really unique about my experience was that I lived this and see it from the greater healthcare lens. So that's what I'll focus on a little bit more today. But just a couple highlights so you know sort of a little bit about my experience. I had a really difficult pregnancy, nothing major medically speaking, but I was sick the entire time. So that really alone can take a huge toll on you. I had a lot of birth trauma. I was in labor for over 30 hours. It was really hard for a lot of reasons, and it ended in hemorrhage for me. So I passed out shortly after Julian was born, and none of the good stuff that you hear about with golden hour and snuggling a newborn baby and feeling so in love. I was asleep and very confused when I woke up. So a lot of birth trauma, and then after that, things started to deteriorate really quickly. And I thought, my family thought, okay, good, all that's over, thank God, you're okay, you're healthy, it's gonna get better from here. So it was a total shock to us when it continued to get worse and worse and worse. But we trust in the healthcare system, we're closely connected to it, and I'm kind of an open book. So that is something that I'm really grateful for too, because I know a lot of people suffer in silence and don't speak up about it, but I was grab my mom and my husband and be I'm not okay, I don't know what's happening, I don't even really know how to describe it, but I'm this isn't good, I can't, this, I need some sort of help. And just time and time again, we just had experiences where that help was a lot harder to get than you'd think. So for all the times you hear like, it's important to speak up, it's important to screen, I think I've learned that it can be super hard if you then get some number of people that are willing to come forward and be like, this is really hard, but I'm going to admit to you how much I'm struggling. And then if that connection to the next step isn't seamless, like, it's so disheartening. So I had a lot of experiences like that. So unfortunately, I ended at up in inpatient psychiatry unit here in the cities, just 15 days postpartum. So super hard to be stripped from your baby at that point. And that was my first experience with the mental health system. So that alone, I think now, farther removed from that and looking at this more through my healthcare lens, that's really scary that there's a lot of people that aren't interacting with any form of mental health care until they're in like an inpatient unit, because that was horrifying for a number of reasons. The biggest of which was just being separated from my baby, because he was truly holding Julian was one of the only things that like helped with my anxiety. So to take that away was like just super hard. Fortunately, while I was in the hospital, that gave my family some time to do some more research. So my mom found that we actually, and I'll get into this more in a second, but we're super lucky here in Minnesota. We have a mother-baby partial hospitalization program downtown here, which is only one of a handful in the country. So once she found that, things in my journey started to really turn around, and it took a long time to like get to what I felt like was full recovery. But that was a huge turning point, and that allowed me to get discharged from the hospital because we had a credible plan, and I met with that team the very next day, and so we started the really long uphill climb at that point. That gave me some incredible tools to get stabilized, but a couple months out, I was trying to figure out, can I return to work? Can I do any of the things I had planned? And I still just at the end of the day wasn't feeling like myself, so I was no longer like in imminent danger, but that's a really far cry from feeling like you're good and you can enjoy being a mom. So we took a huge leap of faith. But that video mentioned the first oral medication for postpartum depression. That came out 2 years ago, just after my experience. So when I went through all of this, the only thing on the market specifically indicated for postpartum depression was a IV infusion where you have to be in the hospital, and it was given over the course of 3 days. And nowhere in the state of Minnesota did they offer it at the time. But I did some digging and I found that they offered it at WashU, which is where I went to college. It's where I met my husband Alex, and so it was terrifying. I had asked doctors about this. They were like, I've never heard of that. So to elect to travel out of state with a tiny baby to go get something that your doctors don't even know about was really hard, but it was because it was at WashU, and we're like, well, if WashU offers it, it's gotta be a real thing, because we trust them. So I'm so grateful I had that opportunity. Of course, how rare is that you have like the ability to go travel out of state? My mom came with me. I would never have been able to do that on my own, but that again was another huge turning point in my journey that has just made me so passionate about talking about this, because like it was a night and day difference for me by the time I got out of there. And so it's just really important to me to talk about it, because I know I've also learned that just because a medication exists and it's effective, turns out that's not going to be enough necessarily for everyone to know about it or to get access to it. And then since then, I've still been in ongoing psychiatry and therapy, primarily focusing on OCD and trauma, which were the lingering pieces well past some of this other stuff. So those are just some of the highlights of my journey, and I'm more than happy to answer any questions about it, but I'm going to jump a little bit more into the healthcare side of it next. So I wanted to really briefly recap. We just watched a lot about this, but definition of perinatal mental health. So one huge learning for us is it's so much more than postpartum depression. So it's awesome that there's a lot more discussion around postpartum depression now than there was 30 years ago, but there's also postpartum anxiety, panic disorder, OCD, psychosis, and none of those things really get the same amount of airtime in the general public and also in healthcare settings. And so in my case, my first symptoms were anxiety and OCD, and so it didn't match what I had. We dug up my handouts from the hospital, and I was frantically, of course, Googling online, like, what the hell is happening to me? and didn't recognize any of it. So I was like, is it normal that I can't eat anymore? Like, I don't see that as a symptom, but I'm not crying all the time, and I'm not really that sad. I just, like, I can't eat and I can't sleep. And so it turns out, like, all of those are textbook postpartum anxiety, but that information is just a lot harder to find today. So unfortunately at the time, I just concluded that this isn't a thing, this is just me, and I'm like somehow broken or not cut out for this. So if you want to know anything else about any of those specific conditions, PSI is a really incredible resource. That website has like everything you need to know about all of these and how they can show up separately or together. And I'm also going to pause here to note that paternal mental health and paternal postpartum depression is absolutely also a thing. I learned about that just from all of the research we've done here. It of course doesn't have as much of a hormonal component as postpartum depression can have for someone who just gave birth, but it's also really, really common and has a lot of sad outcomes as well. So we have a fact sheet up there if that's something that you want to learn more about. I thought that was really interesting and just something I had never heard of before. So as you saw in the documentary, perinatal mental health disorders are the #1 complication of childbirth. Somehow it's, despite that prevalence, it gets so little airtime in the healthcare setting in particular. But to put some of the statistics into context for us here in Minnesota, where we have about 60,000 births a year, that would mean that about 12,000 women and 6,000 men every year are going through this. And honestly, that's probably an understatement. So 60,000 births, this can also affect people during pregnancy, and so I think it's even higher than that. And unfortunately, most sources I've seen would suggest that less than half or far less than half of those people will end up getting treatment at all. So again, my healthcare lens on this eventually is like, holy cow, there is just such an unmet need, and we have to figure out how we're going to close that before like the next generation of girls are considering having children. And as you already know, these conditions have enormous consequences. So it's not like we're not talking about them because it's just some sadness here or there. It's a huge deal, and a lot of research recently has shown that this is actually the leading cause of death in the for maternal mortality. So that's really, really scary that we haven't focused on it a little bit more just as a healthcare system and as a society. And of course, suicide is like the worst possible outcome, so it's really just the tip of the iceberg, and there's a lot of suffering underneath that too. Another thing I want to highlight is that the impact on children is really significant. So if I start to feel my passion around this or my confidence waning a little bit, all I have to do is start to think about like what risks this put Julian at before I start to feel like fired up and ready to go again. Because there's a lot of research to show that even for those who make it through and or don't have as severe symptoms, untreated maternal mental health disorders has just an enormous impact on the kids involved, because that is such a crucial period of brain development that whether or not your caretaker as well has a huge impact. So studies have shown untreated maternal mental health increases rates of preterm birth and low birth weight, as well as later childhood health issues and the lifetime risk of mental health disorders for that child. And they've even gone so far to like demonstrate that this is true of even just if they had untreated anxiety in pregnancy, which is scary because a lot of people today go off antidepressants in pregnancy thinking that that's what's best for their child, and it turns out that like that's in itself putting a child at higher risk for later problems. So this is really something I've been trying to stress, because I think it helps demonstrate that this is not just a women's issue, it's also not even just a parent's issue. Like every single one of us, it was influenced by the mental health of our early caregivers. So I'm trying to really help people see that this is the most upstream way we could start investing more in children's mental health too. In terms of trying to quantify the costs here, there's been a really interesting study fairly recently in the United States trying to pinpoint what this is costing us today. And they came out with one that says for everything from increased medical expenditures to decreased economic productivity, not returning to work at less than full steam, etc., that the total societal cost of an untreated case of perinatal mental health was about 32,000 on average per case. So again, I'm trying to just put this into context for our state. With 60,000 births a year, 20% prevalence, 75% of which might be untreated, at an average cost of 32,000. Every single year, that's costing us, like on a societal level, about 286 million. So it's just a rough estimate, of course, but I think it's really helpful as we try to figure out like how do you start making the case for what will ultimately be pretty costly infrastructure to do more on the front end to support people. The real answer to me is that we're already spending a ton of money on this. We just are doing it in a different way, and we could spend a whole lot less investing more in upstream interventions. And then the great news, and honestly, again, the reason we're here doing all of this is that these conditions are both temporary and treatable. So it's hard to believe given like how much suffering there is around this, but they are treatable, and that's like, I'm so grateful that I eventually got on the path to getting all the different things that can help someone get out of that hole. So this is a slide that I had put together just to try to articulate to people within healthcare like what this continuum of care looks like. So on the lower end, you got outpatient therapy and psychiatry, which is most common and most accessible. And for a lot of people, this is absolutely sufficient in helping them manage their conditions and eventually recover. But just like for any other health condition, sometimes people need more intensive levels of care. So when you start to be needing more than you can get through outpatient therapy and psychiatry, there are specialized intensive outpatient programs. So that's usually a couple days a week for a couple hours at a time. And then there is the next step up from that is partial hospitalization. So that's what I ended up doing through Hennepin here downtown. That's a little bit more intensive, so most days of the week for several hours a day. And then on the highest end of the spectrum is inpatient care. So you can see up there, we only have 5 of those in the US. So it's just not something that's accessible to most women. At least here in the U.S. Again. So as somebody who has been hospitalized on a general inpatient psychiatry ward, I also just wanted to share my opinion that general inpatient psychiatry is not it. So I think I've run into that a lot in healthcare where people are like, well, if you're one of the unfortunate people that reaches that level where you really need round-the-clock care, the best we can do, of course the best we could do would be this general inpatient psychiatry unit. It was really traumatizing to me for a million different reasons. It's also what I needed at the time because I needed people with me 24/7, and my family was also trying to help me care for a newborn. So I'm grateful that I went, and it's absolutely not the answer. And a lot of countries do this a heck of a lot better. So it's also not that like this is a lofty, crazy idea. There are countries that have inpatient units designed for this population. And we just really haven't caught up in the US, which is really frustrating to me. And Minnesota is actually an outlier when you look at the rest of the United States. We don't have any specialized inpatient units here, unfortunately, but in terms of outpatient care, we have way more than most parts of the country. I feel so fortunate that I was living here when I went through this experience. Because I ended up going to Hennepin's partial hospitalization program, and that's, like I said, one of only a handful in the country. So I didn't realize at the time, but I was super lucky that that was even an option, because most women don't have anything like that within hundreds of miles. This is a map that came out last year from one of the maternal mental health advocacy organizations, and it is looking at maternal mental health professional shortage areas. So the darker the purple that you see here, the higher the need, or the greater the shortage. So as you can see, Minnesota stands out as somewhere where there's actually more resources than just about anywhere in the country. But before we get too comfortable about that, obviously, I still really struggled. I did an informal survey. I think some of you guys probably helped me with distributing that to get some more feedback, so I appreciate that. But I did this survey to try to understand whether the experiences I had were a one-off or were more of a common pattern. I ended up getting almost 90 responses, which was incredible. and most of which, just based on the circles that this was distributed in, were from Minnesota. So I wanted to share with you guys today a few things that came through that survey, which again have like given me a lot of fuel for this fight, because I know it's not, what happened to me did not just happen to me, it's happening repeatedly by design to a lot of people, even here in Minnesota, and I felt like this is really important to call out so that we don't, in general and in healthcare, rest on being better than other states. So, just some direct quotes from that survey. I was questioned about mental health at several prenatal appointments, but then felt like it was a hot potato situation when I needed help. I felt like I shouldn't have had to advocate so hard for myself. I was simply given the phone number to call to schedule behavioral therapy, but there was never any appointments available and they schedule only 3 months out. What a kick to someone with depression. Just call again and maybe in 3 months. Useless. There's a huge lack of resources. My pediatrician gave me the screening forms where I rated feeling suicidal for multiple visits and never once had someone reach out. There were so many opportunities for the system to step in, but I was still left alone to navigate all of this. So overwhelming. And then the last one for today, breastfeeding was pushed over bonding with my baby and the journey was not going well. I wish someone would have had a talk with me that if breastfeeding wasn't going well or interfering with my well-being, that it would be okay to give my baby formula. I did not recognize at the time how much this contributed to my postpartum anxiety and depression. I felt like a failure. So again, these are all quotes from women here in Minnesota. So what I wanted to leave you with here is just that, again, it's not going well just because it looks like it on paper compared to other states. One of the specific questions I asked in that survey, so as a healthcare administrator, what I was most interested in was, are other women having the same experiences with the healthcare system specifically that I had? So I asked, please rate how supported you felt by the healthcare system during your journey with perinatal mental illness. And so that's the results there on the left, as you can see. No surprise, the answer is not well in summary. So over half of the people who responded to the survey rated their experiences a 1 or a 2 out of 5. But on the other hand, I think another interesting way to look at this is that there were 4s and 5s. So I've been also trying to help share that with some of the leaders in healthcare that I've had a chance to talk about this with, because it's not impossible. Like, you can design systems that make women feel supported. A lot of these, if you looked at the specific comments, were women who said, like, I just got, my OB took this so seriously and I'm really lucky and I like owe all of my recovery to them. And so that tells me that it's not impossible and it's worth figuring out how we can replicate that so that everybody has that experience and it's not luck of the draw with whether or not your OB personally either had this happen to them or a close friend, and that being the reason that they might know about it or not. Because it's not in education, by the way. My husband and I have talked about that a lot. He had no idea what was happening. It's not talked about in med school, or if it is, it's like a really, really brief comment about postpartum depression. And you probably assume that that's different for OB. I don't really think that it is, because there's a lot of people that we run into who just don't know anything about it. So that in itself is something really scary, given that, again, it's the most common complication. The final thing I want to share before I'm going to pass it on to a couple others is that as bad as the stats are right now, if we don't make some major changes right now, my expectation is that this is just going to continue to get worse, because rates of depression among teens and specifically teenage girls are rising, and we've seen that from the pandemic and other factors over the last decade. And history of depression is the single biggest predictor for risk of postpartum depression. So that's the kind of thing that keeps me up at night. That's what drives some of my fire in this. It really horrifies me to think about where we're headed with this if we don't step in and build the system that we would need to support women through this. I am so fortunate that I made it to a place where I get to love on my goofy, opinionated little toddler that some of you guys know. He is the most amazing person, and I can't, it's so hard for me to believe that I almost got, like, I missed out on some of that early joy, and I could have missed out on the entire thing, which, like,
oh my God, it is so crazy to me, because I love being a mom and I feel really confident in it now. And if you knew me at 2 weeks postpartum, like it couldn't be more different. So all of this comes from just a place of gratitude and wanting to scream from the rooftops about the resources that do help, so that if you or anyone that you know ever mentions like, hey, I'm maybe struggling a little bit, that you know like how to help them start getting connected to things, because it's so possible to have a really happy outcome from all of this. So next I'm going to turn it over to Melissa. So Melissa Treff is a licensed perinatal psychologist who really generously offered to come share some insights as a trained professional in the field. So really, really appreciate that. Thank you.